We had an unexpected change. Our special guest unfortunately was not able to make it today. So we are going to do a special encore presentation for common side effects of many pharmaceutical drugs. This is a very concerning topic because many patients of us are seeing these side effects of pharmaceutical drugs that are commonly prescribed that are not told to them. And I also want you to know that there are natural alternatives that can be just as effective. Before we begin, I want to emphasize that people should not take themselves off any prescribed medication without first talking to their doctor. Now, I can't even count the number of times that a patient has come to me and they're on a certain drug, and I talk about some of the potential side effects. I watch their eyes get wider, watch them frown, and say, if someone had told me about the risks of this drug, I wouldn't have taken that. Nobody ever told me that. So yes, when we get a drug, there are inserts that list potential side effects, but honestly, how many of us actually take the time to read the very small print with hard to pronounce words? And that's not even the point. We're supposed to be told about all the risks and potential side effects before we're prescribed the drug in the first place. That doesn't mean we shouldn't take them. It means we should be informed beforehand so that we know about the risks and can make an informed choice. Most of this really is unfortunately a product of our current healthcare system. Regular doctors typically are just not given enough time to be able to talk with their patients. But a major principle of naturopathic medicine is education. It's one of its biggest strengths. Naturopathic doctors take the time to explain the medication, the procedure, the supplement, and ask if there are any questions. So that said, let's get into the vitally important health information in today's event. So please be assured that, again, there are natural medicines that don't come with all the side effects. So first, oral birth control pills. Many of these drugs have the side effects of increasing the risk of blood clots, which can lead to increased risk for heart attack and stroke with prolonged use. Birth control pills can increase the risk of breast cancer by 20 to 30% over women who have never taken them. The risk does decrease once women stop taking them. Also, there is one class of oral birth control pills that does not increase the risk of blood clots or breast cancer. These are called progestin-only pills and are also sometimes called mini pills. Basically, they don't contain estrogen, just the synthetic form of progesterone. Acid-blocking drugs for acid reflux. There is an increased risk of dementia with some of the drugs. Did you know that? Most of my patients who are on them did not know that. Using them long-term, 6 months or more, can increase the risk of also becoming deficient in vitamin B12 and iron, because you need stomach acid to. The most common symptom of iron deficiency is fatigue and being short of breath. I've also seen a decrease in attention and focus because iron carries oxygen. I want to mention that for now we are still welcoming new patients, and to make sure our practice is the right choice, there is a no-charge phone consultation with me in advance of scheduling your initial appointment. This is so that you can talk with me personally about your health concerns. Our phone and other contact information is on our Facebook page. And please remember to visit our online supplement store, which is on our website at drtaketa-wong.com. That's drtaketa-wong.com. Our prices are very competitive, and the proceeds go to helping children with special needs with their medical treatment. A link is in the post with this video. Antibiotics. Antibiotics are extremely commonly prescribed. They can increase the risk of genital yeast infections and skin infections. They also commonly cause diarrhea, upset stomach, even nausea and vomiting. They decrease the good bacteria along with the bad, and killing off the good guys can cause long-term problems with your gut and with your immune system. Many of our patients that come to us have been dealing with gut issues and other kinds of immune system problems that all started after prolonged courses and often of multiple antibiotics. Cipro and similar antibiotics can also increase the risk of tendon rupture. So in fact, many doctors, including me, advise their patients not to exercise while on those drugs. There is also a greater risk of antibiotic resistance the more often that you take antibiotics, which can make curing future infections more difficult. Antibiotics, as well as other types of drugs, can affect the normal good bacteria in our gut, which can then change neurotransmitters, which are brain chemicals. Among other things, a change in the brain chemicals can affect our mood, focus, and attention. So in response to this, we often will try to use herbs or other natural medicines that help to kill bacteria to address infections instead of using antibiotics. Epidurals during birth. Epidurals can increase the risk of seizures, infections, and nerve damage in the mother. Also, I've seen a number of women who have had chronic back pain just after giving birth after they've had an epidural. They say that it's in the one spot where the needle for the epidural went in, and many of them say, if I had known that I could have had back pain for the rest of my life, I would have refused the epidural. So just knowing that that is a side effect, a possible side effect, is important in making an informed decision. For the baby, epidurals can increase the risk of decreased oxygen and heart rate during the birth process. Pitocin during birth. Research has definitely found that using Pitocin to induce labor can increase the likelihood of a needed C-section. That's because it can force the birth process where the baby may not be in the best position to deliver. It can also increase the pain for the mom because it's forcing the uterus to contract in a much more intense way than it would naturally. There's a possibility that the uterus could rupture, causing more blood loss. As to risk to the baby, there is potential fetal distress where the baby isn't getting enough oxygen, and it can also increase the risk of seizures in the infant after birth. Again, it doesn't necessarily mean that you don't want to use Pitocin to induce labor, but it's just good to know that there are alternatives. Acupuncture has been found to be helpful to induce labor, and there are herbs and other things that can be helpful in inducing labor, and also making sure that you're not choosing to induce labor when it's not medically necessary. So those kinds of reasons would include your OBGYN is going on vacation. They want you to deliver before they go on vacation. That's not a good reason to induce labor. So these are things to be able to talk with your OBGYN about. Also, moving on to the next group, blood pressure medications. So these are just a few of the big categories. I'm just going to go through a few of the side effects, but it's very important to not abruptly discontinue blood pressure medications. And this is a reason that can be good to work with a holistic doctor, because there are many other options, but it's very important to make sure that your blood pressure is under control so that you're not increasing the risk of heart attack or stroke. Beta blockers are a class of drugs that frequently can cause fatigue, asthma, and difficulty sleeping. Diuretic blood pressure drugs can cause fatigue, leg cramps, and more frequent urination. For some people, that can also disrupt their sleep. ACE inhibitors commonly cause dry cough and skin rash. And finally, calcium channel blockers can cause constipation, dizziness, and headache. So if you're experiencing any of these side effects and you're taking a blood pressure medication, it's a good reason to talk to your doctor about it, and also to work with a holistic doctor working with natural medicines to be able to safely control the blood pressure, and seeing if we can be able to wean you off of blood pressure medications or wean down on medications in a safe way. Cholesterol medications. Statin drugs, which are the major class of drugs that are used for cholesterol, deplete a substance called CoQ10, which is a major antioxidant that's important for your heart health. So using them puts people at risk for heart issues. Research has shown a link between statins and memory loss and difficulty with memory in general. Other side effects include nausea, gas, and constipation, and an increased risk of diabetes. The most common side effects are muscle weakness and pain. Long-term, they can cause muscle damage and harm to the liver as well. So talk to us about alternatives. There are many natural medicines and ways to be able to help to decrease cholesterol and be able to safely wean people off of statin drugs. In conclusion, I trust our discussion about the very concerning side effects of commonly used drugs has been useful for you. Please remember that with these medications, again, especially with blood pressure drugs, it can be dangerous to just stop and take yourself off of them. So be sure to talk with your doctor before doing so, or talk with a holistic doctor like myself. There are natural alternatives to many of the drugs that do not carry the side effects, and I work with many patients to wean them off of their drugs. But again, you should avoid. With our no-charge consultation, you're welcome to talk with me personally about the drugs you're taking or any health concerns that you may have so that you too can be empowered with your health. All the contact information is on our Facebook page. If you purchase supplements, please visit our online supplement store, which is on our website at drtaketa-wong.com. Our prices are competitive with Amazon. You can trust the products because they're coming directly from the manufacturers, and the proceeds go to helping children with special needs with their medical treatment. A link is in the post with this video. Mahalo, and we look forward to seeing you in 2 weeks. Aloha.